I often struggle with ways to make sure that families are empowered to be their own best advocate. So one of the things I'm going to just put in a plug for palliative care is if you are a family who has a child who's currently in the hospital, and it's a hospital that has a palliative care team, and you feel like you haven't been heard, or you feel like there's something else going on, you feel like you're being diminished, or you're being labeled or categorized differently, or you're receiving treatments or policies that other families aren't having to receive. Like, do you have a visitor policy? Do you have a behavioral policy? Did you show grief in a way or anger in a way about a treatment decision that somebody felt was unacceptable? And you feel like that's continued to impact your care. If you happen to be somewhere where they have a palliative care team, then I would ask for a palliative care consult. You can say, I'm having a really hard time. I feel like we've had a lot of communication breakdowns. Do we have a palliative care team here? I would love to have the additional support, because any family can ask to have that support. And I see one of the roles of our team as being a bridge for community to empower communication between families and teams. And often, if you've had a long hospital stay, communication has been disrupted because somewhere along the way, somebody has made a decision about you and the way you care for your child, or the way you made decisions, that kind of trickles down. We hear it all the time. Oh, this is the family that XYZ. Well, this is the one that this, oh, they're never here. Did you know their mom's at home on hospice? Okay. They are here. They come at night. So just having a palliative care consult, sometimes you can provide additional context, because I think teams are trying to do the right thing, but people don't realize the way bias is perpetuated in our notes, in the charts, in our sign outs. Um, and we haven't given the family the opportunity to present themselves through their own voice. Like, we are using the voice of other people. I call it, it's called testimonial injustice. So I'm giving a testimony for the family based on my judgment, your sign out, what I read in the note in the ER from 6 months ago. Like that they're not, that's not even them anymore. So if you do recognize this, ask for a supportive medicine consult. If you're somewhere that you don't have a palliative care team, you can always ask to speak to the family liaison, family representative for the hospital. Every hospital has one. Even if they tell you they don't, everybody has one. Their job is to make sure that we improve communication so that the hospital can mitigate adverse impacts of poor care for patients. And so you can always ask for that. If you don't get that, if you have social work, everybody has social work, you can tell social work, you know what? I don't feel like we're on the same page. I would like to have a family meeting. I'm surprised at the number of families that don't realize that they can request a meeting. You know what? It's a different team every week. I'm hearing something different every time. I'm not quite sure how information is being conveyed, or that me and my partner are even on the same page as you guys. I always say, not the same. We're not even in the same book, let alone the same page. I would like to have a multidisciplinary meeting to just really review where we are with our child and make sure everybody's on the same page in terms of what is important to us, because I know that we've had a few hiccups. We've had some challenges. You guys have had some challenges, but I would like to have a family meeting. We actually just recently had a family that said, you know what? The attendant changes every 2 weeks. And from here on out, don't call us when there's a problem. We need the new attendant to call us every on Mondays when they change, just to say, hey, I'm Dr. Kincaid. I'm taking care of your baby today. These are my plans for the week, and this is what I understand is important to you. Is that still true? Because they were kind of frustrated that, not that we weren't taking care of the baby, but just so many changes. And when your kid has been in the NICU a long time, you know the baby better than everybody else. I don't care how good the discharge summary is, and you don't want to keep making the same mistakes. So ask for a supportive medicine consult, ask for the family liaison, talk to the social worker. You can talk to the charge nurse too, but sometimes the charge nurse has been the problem for families. Like, they did talk to the charge nurse, and then they got labeled. You know, I love charge nurses. So if you're listening, charge nurses, I'm team charge nurse. But sometimes some of the framing can happen after that. People don't feel safe. Their concerns may not be presented objectively, may be reduced to the complaint, et cetera. But by all means, your charge nurse can be a contact before you reach to the family. But just know you have a voice. You're the most important person on the team for your family, for your child. You're not a visitor, and your voice deserves to be heard. And you should not feel like you have to change your behavior or your advocacy to feel like your child is getting the best care. I literally had a family last week say, I promise you, I did my best. I didn't want to be the angry Nigerian mom, but I had to be the angry. And I just started laughing. And I had another mom say, and I love this. I'm trying to find a way to put it in an essay. She said, Dr. Terri, I decided a long time ago that I either had to be that mom or the I told you so mom. And she said, the I told you so mom means that I didn't speak up for my child. And now my child has an adverse consequence. And I'm saying I told you so. Instead of, I'm that mom. We've done that before. My child does not respond well to that. Can we please think about other ways to approach this?